In the name of Allah, the most gracious and the most merciful, may peace, mercy, and blessings of Allah be upon all of you. Factors affecting mental health. Good mental health is more than just the absence of mental illness. It can be seen as a state of mental health that allows one to flourish and fully enjoy life. Everyone experiences down times in life. The ability to cope with negative experiences varies greatly from one person to another, and in large part determines whether people enjoy their lives. Some of the factors that affect the mental health of children are as follows. Number 1, self-esteem. This is the value we place on ourselves, our positive self-image and sense of self-growth. People with high self-esteem generally have a positive outlook and are satisfied with themselves most of the time. Number 2, feeling loud. Children who feel loud, trusted and accepted by their parents and others are far more likely to have good self-esteem. They are also more likely to feel comfortable, safe and secure, and are better able to communicate and develop positive relationships in the school. 3. Confidence. Children should be encouraged to discover their own unique qualities and have the confidence to face challenges and take risks. Children who are brought up to have confidence in themselves are more likely to have a positive attitude and to lead happy and productive lives. 4. Family breakup or loss. Separation or divorce or the loss of a parent is extremely painful. Finding ways to cope and adjust to the changes wrought by the brought by these events is critical for everyone, but particularly for children. How grief is handled can affect children negatively for years to come. If children are having difficulty coping, professional help is recommended. 5. Difficult behavior. When children are unhappy, they either internalize their unhappiness or act out. The latter usually appears as bad or difficult behavior, such as using abusive language, being aggressive or violent, damaging property, stealing, lying, refusing to comply with requests or expectations at school or home, or displaying other inappropriate actions. If such behavior is serious and persistent, the child might require help. 6. Physical ill health. Diseases, injuries, and other physical problems often contribute to poor mental health and sometimes mental illness. Some physical causes, such as birth trauma, brain injury, or drug abuse, can directly affect brain chemistry and contribute to mental illness. More commonly, poor physical health can affect self-esteem and children's ability to meet their goals, which leads to unhappiness or even depression. In such cases, receiving the best possible treatment for both the physical problem and the resulting psychological consequences is key to optimal recovery to good mental health. Number 7, abuse. The mental health of abused children is at great risk. Abused children are more likely to experience mental disorders or mental illness during childhood and into adulthood. Abuse may be psychological or verbal. It may not always be evident or easily recognized. Regardless of the form it takes, abuse cannot be tolerated. Children need to be protected from abuse and help to overcome its negative effects. Abuse can cause feelings of low self-esteem, lack of self-confidence, depression, isolation, and anger, all feelings that impair a child's chance to lead a happy life. Trust in others and feelings of being safe and cared for are key components to recovery from abuse. Few children are able to recover on their own. Support is critical, and professional counseling is sometimes required. If abuse is discovered early, the chances of a child returning to a healthy state of mind and avoiding serious mental disorders are greatly enhanced. 8. Emotional disorders. Emotional disorders commonly emerge during adolescence. In addition to depression or anxiety, children with emotional disorders can also experience excessive irritability, frustration, or anger. Symptoms can overlap across more than one emotional disorder, with rapid and unexpected changes in mood and emotional outbursts. Globally, depression is the ninth leading cause of illness and disability. Anxiety is the eighth leading cause. Emotional disorders can be profoundly disabling to an children's functioning, affecting schoolwork or an attendance. Withdrawal or avoidance of family, peers, or the community can exacerbate exacerbate isolation and loneliness. At its worst, depression can lead to suicide. 9. Childhood behavioral disorders. Childhood behavioral disorders are the sixth leading cause of disease. Sixth leading cause of disease is childhood behavioral disorders. Childhood behavioral disorders represent repeated, severe, and non-age appropriate behaviors such as hyperactivity and inattention, such as attention deficit hyperactivity disorder or destructive or challenging behaviors, for example, conduct disorder. Childhood behavioral disorders can affect adolescents' education and are sometimes associated with contact with judicial systems. 10. Eating disorders. Eating disorders commonly emerge during adolescence and young adulthood. Most eating disorders affect females more commonly than males. Eating disorders such as anorexia nervosa, bulimia nervosa, and binge eating disorders are characterized by harmful eating behaviors such as restricting calories or binge eating. Anorexia and bulimia nervosa also include a preoccupation with food, body shape or weight, and behaviors such as excessive exercise or vomiting to compensate for calorie intake. People with anorexia nervosa have a low body weight and a heightened fear of weight gain. People with binge eating disorder can experience feelings of distress, guilt, or self disgust when binge eating. Eating disorders are detrimental to health and often coexist with depression, anxiety, and or substance misuse. 11. Psychosis. Disorders which include symptoms of psychosis most commonly emerge in late adolescence or early adulthood. Symptoms of psychosis can include hallucinations such as hearing or seeing things which are not there, or delusions including fixed, non-accurate beliefs. Experiences of psychosis can severely impair an adolescent's ability to participate in daily life and education. In many contexts, children with psychosis are highly stigmatized and at risk of human rights violations. 12. Suicide and self-harm. Suicide is the third leading cause of death in the world. Third leading cause of death in the world is suicide. Suicide attempts can be impulsive or associated with a feeling of hopelessness or loneliness. Risk factors for suicide are multifaceted, including harmful use of alcohol, abuse in childhood, stigma against help seeking, barriers to accessing care and access to means, communication through digital media about societal behavior is an emerging concern for children. 13. Bullying. Bullying is usually targeted behavior that is repetitive and persistent. It can have long lasting effects on children's mental health and academic performance. 14. Child abuse and neglect. Child maltreatment is any action causing potentially significant harm to a child. Maltreatment can be initiated by an adult or a child. It can involve physical, verbal, sexual, or emotional abuse, neglect, or exploitation. 15. Family problems. Demographic and societal changes over recent decades have led to much greater diversity and complexity in family forms. Children today are more likely to experience parental separation, lone parenting, step families, half siblings, and new family structures. 16. Family violence. Family violence. Family or domestic violence or abuse can be physical, emotional, psychological, or financial. It can include any situation where child is forced to alter their behavior due to fear of their partner's reaction. 16. Poor parental mental health. Many parents who experience mental illness are excellent parents. With the right support, it's perfectly possible to manage mental health issues without it affecting parenting. 17. Poverty and unemployment. Children living in poverty often lack material resources which can affect what they eat, their participation in activities, the clothes they wear, family stress levels and optimism, where and how they live, and their access to proper healthcare and high quality education.